welcome to our school. And my name is Gilajva Ayam, and thank you for joining us today.
It's a great honor and pleasure to be at such an inspiring school.
Okay, first of all, Dr. Syla, as a WHO representative and head of country office in Kazakhstan, can you share your main responsibilities in this role?
Definitely. I started to work in Kazakhstan as February 2023, and as representative of World Health Organization, I represent Director General of World Health Organization into country, Dr. Tedros, and I interact with institutions, with government of Kazakhstan, mainly Ministry of Health, Ministry of Foreign Affairs, but also other ministries when it comes to promoting health of the people. But I interact also with different UN agencies. World Health Organization is part of United Nations system in Kazakhstan. Right now, even I'm acting UN resident coordinator because the former resident coordinator left the country. And also, I'm interacting on day-to-day basis with different donors in order to bring resources to the country, to support the country for healthier and safer future for everyone. Apart from this external relation that I'm acting on day-to-day basis in order to represent the World Health Organization in the best possible way, I lead the country office team, which I'm proud of them. We have 20 staff members that are working in different areas towards promoting public health and also building a society with a health system which would be able to face the challenges of the future.
Okay, it sounds very interesting. The next question, Dr. Syla, with an extensive experience in public health, mental health, and other areas, can you share a specific project that was particularly memorable and impactful for you?
Well, in general, I'm working with World Health Organization since January 2000. So it's about quarter of century to work with organization. Of course, there are different milestones in the career when the person would remember many different moments, but the key was to help people in need. And I will share with you my initial work with World Health Organization as National Professional Officer in my home country, in Kosovo. The Kosovo, as a result of the conflict after '99, many health facilities were destroyed. Many people lost lives, lost the loved ones, but the most important that they never lost hope for better future. As I mentioned to you, it was very cold winter day of 2000 that I joined World Health Organization. And in the first days of this work, I have helped maternities in which were born babies, and due to low temperatures, many babies were dying, and we provided clothes that were provided by different humanitarian organizations, but also the training to medical staff in order to keep the warm these babies that were dying. So this is memorable moments because we do not just create policies and strategies, but we help also people in need. As a result of our work with all healthcare workers across the country, we have reduced significantly so-called perinatal mortality rate, the number of children that are dying within the first week of life, and this for sure would be the memory through entire my life.
Yeah, your experience is so inspiring for young generation. Thank you for your answer. Kazakhstan has made progress in public health, but there are still gaps. And what are the top three areas where Kazakhstan could improve public health? And how is WHO supporting these efforts?
Kazakhstan is a great partner of World Health Organization. Since Almaty Declaration in '78, and since presence of World Health Organization over the past 30 years, this year we are marking 30 years of presence in Kazakhstan. Since '94, I consider that the progress was immense in many fields. Increasing life expectancy of the people, reducing maternal mortality ratio, infant mortality rate, improving health literacy of people, improving immunization. But of course, as in any other health system and public health dimension, also Kazakhstan is facing challenges. There should be further strengthening of health financing system in country, that no one is left behind. There are no catastrophic health expenditure of citizens that they will not be able to afford to pay for health services. Also in this area, Kazakhstan made a huge improvement. Further work is towards strengthening immunization system in the country, because in the today's world we see a lot of vaccine hesitancy of the people, and this can impact negatively immunization rate of regular immunization calendar. And the third one, since you asked only three, there are also more, about increasing health literacy of population. Today, every individual, whether child, adolescent, young, adult, is exposed to huge misinformation and disinformation. For example, about healthy eating habits, we are exposed to many advertisements that they promote junk food, sugary drinks, and many others. So we need to promote from the beginning to our children, to our future, that they need to have healthy diet, do regular physical activity, take care about their mental health, and also be proactive part of the society, that they will contribute actively towards healthier and safer.
Theme of this conference, Nuclear Renaissance, Advancing Green Horizons. What public health challenges need to be considered as countries adopt nuclear energy?
In today's world, the humanity is facing many challenges. We see the environmental pollution. We are seeing climate change that are affecting all dimensions, all walks of the life, and the most affected are human health, but also our ecosystem. But at the same time, human beings, they need new resources of the energy. As representative of World Health Organization, part of UN system, we always recommend for finding environmental friendly sources of energy, and also diverse sources of energy, from the solar, from the wind energy, water energy. But of course, sometimes it's not possible to meet the demand. Even you have these alternative sources, and the option comes also the nuclear as a variant of having power energy in order to supply the needs of the humanity. Definitely our experience, our memory throughout history tells us that sometimes, using nuclear energy for different either experiments or many other issues, it could lead to a huge challenges to public health effects in short term, but also long term, because in case that human beings are exposed to radiation and other forms of nuclear energy, it can have immense, profound negative impact that would follow also into other generations. But in today's world, with the advancement of technology, with experience with other countries that they have used nuclear energy for decades, can be put in place a safety system, secure system, in order to minimize or to bring to very low level the risk of any accident, incidents. But we know that they happened, for example, also in Japan and the others, so still the risk is there. But other dimension that we need to make sure is that nuclear energy is also environmental friendly, because it doesn't produce dioxide, carbon, and other pollutants that they can pollute the environment. But these safety measures should be put in place, and the World Health Organization at the global level is providing guidelines and recommendations to policy makers how to be ready in case of any issues are happening in this aspect.
Okay, finally, what advice would you give for students interested in pursuing career public health or humanitarian careers?
Based on my personal experience, I started as humanitarian health worker. Indeed, after I graduated from medical faculty in my home country in Kosovo, I started to work for humanitarian charitable organization, Mother Teresa, in polyclinic, where I provided free services to the people in need. After that, I joined international organization, International Medical Corps, that we provided mobile team clinics to refugees and displaced people that were displaced due to the conflict. And in 2000, January 3rd, I joined World Health Organization. My advice is that if you decide to work for such mission, I would call noble mission, you have to have passion, you have to love it, to have a great commitment, and to have also soft skills in order to interact with people of different walks of the society. You can meet an ordinary person in a village that you need to talk very simple, crystal clear language, understandable, but you could meet also with the president of the country and the prime minister, and not to speak about ministers of health, that you need to be always ready to use the proper language, to use global health diplomacy skills in order to promote health agenda at the highest possible level. So I would recommend anyone who is interested, if I would go back 25 years ago when I started my career, if I would have chance 1,000 times to be asked whether you would do the same, yes, I would do the same. I feel proud of the work that I did, starting in my own country, in Kosovo, in 2000 with WHO, continuing in European Union member state in Bulgaria, and now as February 2023, I'm in this great country in Kazakhstan, where I meet on day-to-day ordinary people with a high level of hospitality. And particularly today, I'm very inspired meeting students of your school, which I hope some of them would become public health leaders, not only to contribute to Kazakhstan, but to contribute to the global citizenship proactive role, which is also the mission of your institution.
Thank you for your answer. It was very exciting and informational. So I'm honored to be a part of this exciting interview with special guest, Dr. Syla.
Pleasure was mine. Thank you very much.
Thank you.